Everyone, I am doing a new update. It's been exactly 2 weeks now since my hair transplant, my second hair transplant. And of course I wanted to show it to all of you. So the scabs, I can pretty much touch it quite comfortably. I clean this area in the shower gently. When I say gently, I turn on the shower at a very light pressure. And then I just kind of gently rub it like how I'm doing right now. Maybe my hands are blocking. Just to remove the scabs as gently as possible. I don't want any of my grafts falling out. There's still some let me see if I can see that. There's still some maybe if I stand this way it might be a better angle even, because I got light hitting it. But there's still some scabs on it, as you probably can't see, but that's coming off slowly and surely, and that's good. Looking in the mirror here, I'm seeing my head. This isn't the best camera phone, and I am trying to save money as I just paid for another hair transplant, as you all know. But there we go. The lighting is better right there, so you can see my head. Oh, that bald spot is where I got my hair transplant at. Hopefully a lot of hair grows out and my head will look quite perfect then, except for of course this front area right here. But so anyways, that's what I was looking at after 2 weeks. The side and the back of the head, you can obviously see it's pretty much perfect. You don't see anything on camera. I can touch it, as you can see. Look, I'm slapping it, hitting it. It's perfect. I feel no pain, no discomfort. I mean, maybe right, it's been a little itchy, I guess, as it's healing. You know, like any wound on your body will get a little itchy. I would say maybe like right here in the back. Just tough to film. I know this is like upside down. I would say like right here at the upper back of my head, where the grafts were taken. Still a little sensitive. That was done on the second day of the surgery, so maybe that's why it's just a tad bit more sensitive. Maybe like right here even. It's just sensitive, and by that I just mean it's very minor. I can sleep completely normally. I still sleep on my chest and my face because I don't want where the grafts are placed to be pulled out by anything. At this point, I think I'm fine. I could sleep on my back, but again, I just want to be sure. I'm just extra cautious of this stuff, you know. You spend a lot of money on this thing. You want the best results possible. Feel free to ask me any questions. I still have a bunch of ACell left. I was given a lot, and my sides have healed so well that I don't really think I need to apply any more to it. I'll ask the doctor about that. It's fully healed. I really don't know what I'd be applying it to. I mean, if you look at it, there's no redness. There's no weirdness to it. No one tells me anything except maybe, like I said, the crown. Maybe they see a little scabbing. I go out without a cap even now. I'm not a big cap guy, so I go out without a cap. I haven't had any strains. Look, no one notices it. It's totally fine. It's totally discreet. Of course, you know, if it was in the front here, if I had scabbing, I'd probably wear a cap like I did last time, because that's going to be more obvious. I'm liking it, and now that the hair's even grown out on top, it's really looking fantastic at this length even. I really just wish my hairline was lower. I like the widow's peak even. I just wish that, I mean, I think you guys all can see how much more hair I wish I had in the front. If it was just like right there, you know, if I just had like this portion filled in. Perfect. Beautiful hair. I could even keep it a short length, you know, use a scissor, cut it just perfect and right, and it's fantastic. If you're bald and balding is bothering you and you feel, you know, hair made you look a lot different, or I know, I can sympathize. I know what it's like being bald, and you know, even if we like being bald, the look of it looks fine on us. The option to have hair is what really is fun to have. The fact that you have hair, you can style it different. Having hair, you can dress different, and it gives you a whole different personality. People see a softer character. So even though baldness might look good on you, you know, having hair, it brings out a different personality in people. And that ACell, getting back to ACell real quickly, I had a bunch left over, and I had a few little scratches maybe on my body or hand or someplace, little bites, bug bite or something, you know. I'm not all pimpled up or anything, but I had a few here and there places, scratches, little stuff like that. And I thought, well, let me apply the ACell, see how it works. You know, specifically I had one on the thumb right here. You're not going to see anything because it's fully healed. I decided to apply some ACell on just to see how quick it heals, and literally overnight or within 2 days, perfect, fully healed. So I guess that ACell really does work, especially on wounds. So if you have some extra left over, apply it on there. Again, I've never really used Neurosporin or anything like that, so maybe even that works just as effectively. So if you're someone who uses that stuff and then you use ACell and you're like, oh, this is the same as Neurosporin, well, you know, I've never really used that stuff, so I'm no expert at it. So I apologize if I'm bragging about ACell if it's the same thing as whatever else. So anyways, leave your comments, questions, concerns, anything you want to bother me with. I mean, it's no bother to me. I did get this at Dr. Sean Benham in Santa Monica. So if you're local and you don't want to miss a lot of time off work and your life, and you just want some quick, easy hair without being as discreet as possible, you know, definitely have a consultation with him to see what he's about, and then you know, make your decision. And feel free to ask me questions. Also, feel free to look at my other videos and see how bald I was this time last year to where I am now, and you will be, I guarantee you, impressed.